miles around my hike on the Appalachian Trail back in 1998. Anything I've learned there? Wow, it's an interesting question. I learned a lot walking from Maine to Georgia in the woods for 5 months. One is know your priorities and know your limitations and be patient. Every step matters. And sometimes it takes a long time to get where you're going, but if you start sprinting, you're never going to get there, right? It's a marathon. It really is, and this is a marathon with a bit of an unknown end. So we have to be cautious about how we go. We can't just sprint forward. To be incredibly irresponsible to do that. You gotta know your limitations in terms of what you can and cannot do, can and cannot expect. Know the limitations of the team. You can't set expectations so high that they can't be met. If you set your expectations high, then you're always going to be coming in under. And in such an unknown situation, when a lot of decisions, I appreciate, fall on the shoulders of the governor here and in other states. I think one of the reasons we talk so much, one of the reasons we do these press conferences, one of the reasons we go to such lengths showing all this data is because transparency is the foundation of public trust. And we want folks to know that, what we know, they know. And they're part of that process and allowing, whether it's the task force to be open in public so people can listen in, or the Gopher committee, and making sure politics isn't in it, making sure it's all open and transparent. These are all the most important foundations of all the decisions that we're making, because we are all in this together. This is not just us driving a boat and hoping everyone gets on board. We are truly all in this together. So getting that input, and I know that seems like a long extraneous answer out of the how that relates to the Appalachian Trail, but it all comes down to knowing your limitations, appreciating what needs to be prioritized. I mean, on the Appalachian Trail, I had to know where to get a glass of water every day, and that became everything in terms of being able to make it to the next day. But knowing that and having a team around you that not just you can work with, but a team that you can empower, really surrounding yourself with the best and the brightest, and letting them do what they do best. That's a very powerful thing, not just for myself, but I think for the 1.35 million people in the state.
The next question comes from Matt Layton with NBC5. Matt, go ahead with your question.
Yeah, Governor, I was wondering if you could just kind of talk further about, you mentioned it earlier, about working with Maine and Vermont. It seems that the reopening of the economy is of a regional approach. So I'm wondering how the decisions that were made for slowly starting to reopen New Hampshire's economy, how you discussed that with Vermont Governor Phil Scott as well as Maine Governor Janet Mills, and even if you had the discussion with Charlie Baker in Massachusetts.
Yeah, I mean, all the governors, we've been sharing ideas both on terms of timing. I would, for example, we were texting back and forth yesterday, I think it was, where we were just saying, hey, look, I think I'm going to make an announcement at the end of the week. Janet Mills in Maine made an announcement earlier in the week. We talk about the concepts that we're going forward with, whether it be opening up opportunities for hospitals or golf or campgrounds or whatever it might be. Some of the ideas of the challenges that we're facing in other areas that weren't even discussed today, like hotels or other areas of tourism. So we're just constantly just batting around ideas, and if good opportunities come, we're all in this together as well. Governor Baker I talk to on a fairly regular basis. It's a very different situation down there, of course. So he's more dealing with still trying to mitigate the spread in any way he can. Unfortunately, the numbers there are so different that he's really they're not unfortunately where we are in terms of the ability to flex some things open. But we constantly work with him. We have a phone call a couple times a week with Governor Baker and all the other governors. I'm talking to governors all across the country. Governor Ducey in Arizona, Governor Burgum in North Dakota, Governor Abbott in Texas. We get on calls all the time and just, what are you seeing there? How did you deal with this? What do you think of the unemployment issue? What are the incentives to getting folks back to work? What can be flexed open first? How are you dealing with the federal government? All of it's on the table with the governors, because through this crisis across the country, governors are the ones that have to operationalize and manage this crisis. We know the 50 governors in this country, and those that are also in the territories as well. We're the ones that are on the front lines of management. The federal government provides some resources and guidance, and that's all very important. And we work with them to get some PPE and the testing materials, because there's a bit of a funnel there. But making sure that a service is rendered or an opportunity is rendered for this individual or that family or that business or that school, that's on us. That's 100% on us, and you can't do it alone. So being able to talk to their teams and having our teams talk to theirs, our Department of Public Health, we'll talk to Vermont's Department of Public Health, let's say, and bat around ideas. Our commissioner of corrections might be talking to their commissioners of corrections in terms of how they would mitigate their plans to mitigate any potential spread in their jails or their prisons, whatever it might be. So it's a great team effort. It really is. And this has been a time over the past couple of months where everyone's come together, at least on the governor's side, put politics aside and just said, we're all in this together. All our doors and our phones are open to each other. And it's been incredibly collaborative and incredibly, I think, beneficial, not just here in New Hampshire, but across the country.
The next question comes from Rick Durbins with the Valley News. Rick, go ahead with your question.
Yes, staying with the theme of corrections, the presentation emphasized that congregate living facilities have been continue to be a source of concern. In New Hampshire, only 11 inmates out of 2,366 have been tested so far. In Vermont, they've had a pretty big. They haven't been as skilled or as lucky in keeping COVID out of the prisons. My question is, at what point would it make sense to aim to do universal testing of the prisoners in the prisons and jails, or alternatively to do universal testing of the staff going in and out of the jails, harkening back to the approach that the
Sure. So the question really revolves around universal testing within our prison system for both the employees as well as the workers. We've been very fortunate, and I think the term you used was both skilled and lucky, frankly. We just have had a very low rate of COVID in any of our systems. We know that could grow exponentially at any given moment, given some of these facilities. Remember that some of the jails and the prisons are naturally set up to be obviously folks are in their cells, so there are a lot of physical barriers already in place. And again, if there are anyone with symptoms, if there's anyone that's suspected that could possibly be that could have COVID, of course we go in and we test. The testing is absolutely available to all of these facilities at any time that it's required. We've just been in a very fortunate situation. If we suspect that something could be outbreaking, of course we'll be there to do the testing. In terms of just going in and blanketly testing everybody across the board, we're probably not there yet, just because the need isn't really there, and we're trying to focus our testing capacity not just on those who have symptoms in the general public, but also those long-term care facilities that are at the highest of risk. Right now, we're fortunate that the jails and the prisons are not in that situation, but if it were to come to that, we could react very, very quickly, right? We have a lot of testing capacity. We can mobilize. It's not just fixed in one location. We can mobilize some of these mobile units very quickly if we have to. Okay, I think that does it for any more questions. Sure.
So it would seem that with more facilities open, more chances for community transmission, there would also need to be an increase in contact tracing for any cases we do get as these facilities reopen. What is the state's plan? Are we beefing that up in the Department of Health and Human Services? And my second question is about testing, which I think that Harvard had an analysis that said that we need 1,100 tests a day. You indicated the goal of 1,500 tests a day. How are we doing with that? And the contact tracing and testing.
Sure. So, and again, I'll let Dr. Chan jump in here at any moment, but I'll say that we are, just to be a little bit repetitive, we're one of the states that have always maintained very strong contact tracing ability. We're always bringing new employees on and new staff on to maintain doing that. We've actually taken over the entire downstairs of a conference hall in Concord to, again, just expand the ability for folks to get on the phones, contact people. It's been a very powerful tool for New Hampshire that we never gave up on, and I think has put us in a kind of a lead position given our proximity to the outbreak in Boston. So no, we'll keep contact tracing up as robust as we can and as robust as we need to, whether it's with employees in the state, which we're doing with now, or we could always bring in outside sources if we really had to do it. So we leave all options on the table, and it's something we definitely won't be turning over. Oh, absolutely. Yeah, we could increase if we had to. Sorry, the second half of the question was
testing.
Testing. So I think just over 1,200 tests, and so we anticipate to maintain that average, if not increase it to the 1,500, which was over and above what the Harvard study said that we needed as a base. Look, I guess I don't look at what we need. Someone can say what we need, and I want to go higher, right? I always want to test more. I always want to get more information. That's always a very powerful thing, so we can keep going back and making sure whatever we're doing is based on data, not just public push or political will or any of that stuff. It's really data and science driven in terms of, and having more testing availability will allow us to do
You're
that.
going to be heading after to go into a place to eat outside, go to
So you think I have time to go out to eat? What do you
I don't know. I'm just saying, but, you know.
I'm not, I haven't really thought about it. No, I mean, not tonight. No, I haven't.
I'm just thinking, like, confident. You were saying these places can open.
Oh, sure. No. Oh, yeah. No. Oh, yeah. Would I? Oh, of course. Oh, absolutely. No, I look forward to the opportunity of doing it. Maybe on the, in a couple of weeks with my kids. Again, it's not going to, the outdoor, it will still be in a takeout mode until May 18th. So we still have a couple of weeks there to be clear about it. And again, we have the ability to flex one way or the other if we have to. But no, I think it's a great opportunity to kind of make motions to start moving forward and start building towards the summer and kind of those heightened months, and see what the data brings. Until then, I'll be on takeout or whatever. I'm not eating healthy lately. I find it's a little.
You don't look like you're wasting all that.
Yeah, the COVID-19, as they call it, right? The COVID diet. Yeah. Well, look, we thank everybody. I appreciate it's been a very long presentation today. These are huge steps that the state is taking. We appreciate that, but we want to again let people involved into our thinking, where the data is, why we're doing certain things, allow to ask questions, allow that public process within the task force, the Reopen New Hampshire Task Force to continue. And I think by getting some feedback over time, we're going to keep making it a better and better process so we can take steps forward. And hopefully they're all steps forward. Hopefully we don't have to take steps back. We can if we have to, but I think everybody wants us to continue to take steps forward in a careful and thoughtful way with science and data behind us, with public health behind us, and always knowing that this viral epidemic has to be the preeminent variable in our decision-making process. So we thank everybody for joining us today for the extended presentation. We want everyone to be safe and have a great weekend. Thank you, guys.